HIV and AIDS, Infectious Disease by Megan St. Jean. In the United States, there are millions of people that are affected by HIV and AIDS. By identifying risks and monitoring individuals, the public health community is able to investigate, prevent, and diagnose the disease faster, so that one day HIV and AIDS will no longer be considered an epidemic. The human immunodeficiency virus is more commonly called HIV. Once an individual has HIV, they will have it for the rest of their lives. HIV is able to hide in an individual's body for a long period of time. Statistics show that 1 in 5 that are infected with HIV have no idea that they're living with the virus. HIV is able to bury itself in the cells, and that is when the attack begins on their T cells as well as their CD4 cells. These are important parts of our immune system. Our bodies need these cells to be strong so that it is able to fight off infections and diseases. When HIV attacks these cells, it uses them to make copies of itself, and once it is done, it will then destroy these cells. As time passes, HIV can destroy so many of an individual's CD4 cells that their body is unable to fight off any infection and disease, and this is when HIV can lead to AIDS. The acquired immunodeficiency syndrome, AIDS, occurs at the final stage of HIV, and once it occurs, an individual's immune system is very badly damaged. It was over 30 years ago in June of 1981 when the first case of AIDS was reported in the United States. Since then, the virus has spread to become an epidemic, one that has a major impact on the health and economy of our nation as well as many others around the world. In the beginning, there were many misconceptions about the virus, since they did not understand how the virus was being passed. There were many myths about HIV. Some people believed that if you touched an individual who was HIV positive, then you too could become infected with the virus. Others believed that even just being in the same room as an HIV positive person meant that they were at risk. It was because of these misconceptions about HIV that people were losing their jobs and not being hired for others if they were HIV positive. We now know that HIV lives and reproduces in an individual's blood and other body fluids, such as seminal fluid, vaginal fluid, breast milk, and rectal mucus. HIV can be transmitted through sexual contact, occupational exposure, such as those who work in the medical field, pregnancy, childbirth, and breastfeeding, injection drug use, and rarely blood transfusion and organ transplants. When you have anal, oral, or vaginal sex with a partner, you will usually have contact with your partner's body fluids. If your partner has HIV, those body fluids can deliver the virus into your bloodstream through microscopic breaks or rips in the delicate lining of your vagina, uvula, penis, rectum, or mouth. Rips in these areas are very common and mostly unnoticeable. HIV can also enter through open sores like those caused by herpes or syphilis. If infected, body fluids get in them. Medical personnel are at risk because they often work with needles and can experience accidental needle pricks. Medical professionals also can be exposed to other bodily fluids such as amniotic fluids that can contain the virus. A pregnant mother can pass the virus through her vaginal fluids to her child. She may also pass the infection to her child through her breast milk. Injection drug users are at higher risk because used needles can be contaminated with infected blood, and by sharing needles, an individual puts the virus directly into their bloodstream. It is very rare in the United States to get HIV from an infected donor during a blood transfusion or organ transplants because we have many screening requirements. It is important to know the risk factors, and the CDC recommends that if an individual is sexually active with more than one partner, that they get tested every 3 to 6 months. If an individual learns that they are HIV positive, it is key that they begin to take retroactive medications to slow the progression of HIV, as well as begin other measures such as wearing protection during sex to help ensure that they are not spreading the disease. In the United States, it is estimated that there are over 1 million people that are living with HIV and AIDS. In Texas alone, there are over 70,000 people that are living with the virus. It is estimated that 1 in 345 Texans are living with HIV, and about 81% of them are men. Over the last decade, the number of new HIV cases has been able to stay stable, with about 4,400 new diagnoses and 1,300 deaths per year. HIV has had a major impact on African Americans living in Texas. They are the largest nationality affected in the state. While African Americans only account for 12% of Texas's population, they account for 37.5% of the HIV positive population. In 2010, the rate of black males living with HIV infection diagnosis is 3.7 times that of white males, and the rate of black females is 12.5 times that of white females. Amongst the African American community in Texas, women are at higher risk for the virus. The most common way that African American women are becoming infected with HIV is by having unprotected sex with males that are HIV positive. While high-risk heterosexual behavior and drug use are important factors influencing HIV infection rates among Black women, other factors also contribute to circumstances that can lead to HIV transmission. These factors include stigma, biological vulnerability, trauma, relationship dynamics, structural influences impacting issues such as poverty, employment, and education, as well as incarceration. Because of the high rate of HIV in the African American community in Texas, the likelihood of becoming exposed to the virus is much higher than that of other nationalities. Like many other states, the leading cause of death in Texas are chronic disease, not infectious disease. So it is surprising to learn that HIV is the ninth leading cause of death for the African Americans in Texas. To help address this issue, the Texas Department of State Health Services funds specific HIV prevention interventions for African Americans. One of the programs is the Sisters Informing Sisters About Topics on AIDS project, and it is designed to empower African American women. It is a group intervention program that is taught to the community by health educators. Another program that Texas offers is a Stay Free of AIDS Arms. It is the largest nonprofit provider of HIV/AIDS case management service in North Texas. It is designed to reduce the incidence of HIV infections and increase the engagement of at-risk Dallas County, Texas minorities of color between the ages of 18 to 24. The 5 goals are 5 processes objectives. First, identify, engage, and maintain stakeholders in the targeted minorities of colored communities. Second, maintain peer leadership from at-risk population. Third, maintain service provider agencies within the profit-defined set of collaborative services. Fourth, develop gender-specific, culturally congruent preventative intervention approaches that represent evidence-based best practices. And fifth, create and implement community building approaches for each defined target population subgroup. The essentials of public health in regards to policy development leads us towards informing, educating, and empowering. The Texas Department of State Health and Service mission is to promote optimal health for individuals and communities while providing effective health, mental health, and substance abuse services to Texans. Because of the epidemic of HIV, many states have enacted laws that require HIV-positive people to inform their sexual partners of their HIV status. If a person fails to follow these laws, they can face serious legal consequences. Texas is one of the states that requires HIV reporting and offers programs such as partner services. Partner notification is covered under Texas Health and Safety Code, Section 81.051, and is most often conducted by DIS. Texas Partner Services is designed to help HIV-positive people inform all partners that they may be infected with HIV and encourage them to get tested. Even if a person does not list possible partners, the program must still provide services to the HIV-positive individual. Under the Texas Administrative Code, there are many individuals that are required to report. It is important that all known cases or suspected cases of HIV and AIDS be reported. Physicians and medical professionals are required to report all suspected cases of HIV and AIDS. Information about all HIV-positive women giving birth, as well as any HIV-exposed infants, needs to be reported as well. Next, we look at how Texas regulations can empower individuals. Knowledge and testing allows people to be empowered. State funding allows Texans to be tested and receive counseling on HIV and AIDS. In Texas, there also are laws that require that testing are confidential as well as anonymous. The anonymous and confidentiality HIV testing is Rule 97.15 of the Texas Administrative Code. The rule states, state-funded primary women's reproductive health and sexually transmitted disease clinics shall provide voluntary and affordable counseling and testing programs for HIV infection or provide referrals to such programs. These entities shall offer both anonymous and confidentiality testing for HIV infections or provide referrals for anonymous and confidential testing. Education is another big part of regulations in Texas on HIV and AIDS. According to Texas's health and safety codes, it requires that state agencies must provide programs that educate the public on the virus through pamphlets on transmissions and preventions. It also states that the public needs to be educated on the transmission risks in social, employment, and educational situations. Healthcare workers under the code must be educated about how to prevent transmission in the workplace and preventative measures. Under Section 85.005 of the code, there are special components of the education program. It must include special components that are designed to reach individuals with behavior conducive to HIV transmissions, those who are under the age of 18, as well as minority groups. Section 85.005 states, in designing education programs for ethnic minorities and in assisting local community organizations in developing education programs for minority groups, the Department shall ensure that the programs reflect the nature and spread of HIV infection in minorities in the state. Throughout the state of Texas, there are many different organizations that are centered around the treatment and prevention of HIV and AIDS. To name a few, there is the AIDS Service of Dallas that helps to provide affordable housing for people that are living with HIV and AIDS. The AIDS Outreach Center, which focuses on education and prevention. The Valley AIDS Council, which is primarily an outpatient care and supportive service. And the Test Texas Coalition, which provides information about routine HIV testing. These are just a very small amount of the many programs across Texas that is aimed at HIV and AIDS. The goal of community mobilization is to affect behavior and bring about social change. Community mobilization involves planned actions meant to reach key segments of the community. The community mobilization process is a dynamic process. It can foster collective power and sustain engagement with communities and provide an opportunity to build social networks and social capital. Community mobilization works to engage the whole community. Texas state regulations say that the state must provide technical support to the community. This is to maximize use of restricted resources to address the HIV epidemic as well as to recruit, train, and use volunteers to deliver HIV services to the community. Mobilizing the community is a Texas goal. The state does this by developing and implementing effective services that educate, prevent, and give social support. Since the first case of HIV in the United States, there have been many policies developed surrounding the epidemic. In 2010, President Obama began the National HIV/AIDS Strategy for the United States. President Obama said, "The United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or social economic circumstances will have an unfettered access to high-quality, life-extending care, free from stigma and discrimination." There are three key components and goals for the NHAS. First, to reduce the number of new HIV infections. Second, to increase the access to care while improving the lives of HIV-positive people. And third, reduce HIV-related disparities and health inequalities. The NHAS plans to reduce the number of new HIV infections by growing HIV prevention efforts in the areas that are most impacted with HIV, making sure that all Americans are educated about HIV and what they can do to prevent it. In 1990, Congress passed the Ryan White Comprehensive AIDS Resource Emergency Act into law. The CARE Act is different from many other health care programs. There are very few disease-specific health care programs in the United States, and the CARE Act is one of these. The CARE Act is the largest federal program that is designed to provide care as well as treatment for those who are living with HIV. The CARE Act helps thousands of HIV-positive people by offering support services and providing medical care. There are 5 parts to the program. Part A of the program provides emergency assistance to areas that are most affected by HIV and AIDS. There are 2 parts to the Part B of the program. The first part provides grants to all states, and the second part provides HIV treatment medications to those who are eligible. Part C provides outpatient health care to HIV-positive people and those living with AIDS. Part D focuses on providing family-centered care for both women and children that are living with HIV and AIDS. And the final one, Part F, includes special projects of national significance, AIDS education and training center programs, dental programs, and minority AIDS initiatives. Ryan White Care funding supports a range of HIV care and medical support services, from testing and counseling to AIDS drug assistance programs to home hospice care. Ryan White Care programs were created to develop, organize, coordinate, and operate more effective and cost-efficient systems for the delivery of essential health care and support services to people living with HIV and AIDS and their families. The state of Texas is often commonly referred to as being part of the Bible Belt. It is because of the fact as part of this Bible Belt that topics such as drugs and sex are often considered taboo. While sex is still discussed, it is often followed by discussing abstinence. In order to help reduce the number of HIV and AIDS cases, it should be important that Texas develop public policies that are associated with safer sex. These policies should recognize same-sex relationships and be designed to reduce the stigma that is often associated with sex. Another policy that could be developed in Texas is one that supports routine HIV testing. Routine testing in all medical settings throughout the state can help assist with early diagnosis. This is important especially to African Americans since they make up the largest population of HIV and AIDS in Texas. The World Health Organization says that the main reason that people are scared to get tested for HIV is because of the fear they have of the stigma and discrimination that surrounds the virus. To assist with this, Texas should develop policies that are designed to reduce stigma and discrimination. HIV-related stigma and discrimination negatively impacts African Americans living with HIV. Social support theory hypothesizes that social support can serve to protect individuals against the negative effects of stressors such as discrimination by leading them to interpret stressful occasions less negatively. And finally, Texas could develop policies that are focused on providing social support for persons living with HIV and AIDS. Social support can have a positive influence on the mental health of those living with the virus. Communities need to show that they are not condemning those who are affected by the virus, but instead that they are there to support them. Stakeholders, no matter the race, gender, or sexual orientation, they are all there to help by guiding policy and setting the example. There are many different stakeholders throughout the state. One stakeholder that is seen in almost every county regarding HIV and AIDS is the Texas Department of State Health Services and the Texas Department of Health and Human Services. Both these organizations are able to assist in the development of new policies regarding HIV and AIDS. They are able to influence whether new policies are developed or not. In the state of Texas, Houston is ranked the 12th highest in the nation for AIDS rates of AIDS diagnosis. They are also one of the cities in the state that has the highest rate of African American citizens. One of the biggest stakeholders in Houston is the Houston Area HIV Planning Group. This group is very involved in trying to reduce HIV and AIDS in their community. There are many individuals that are on their board that have been affected by the virus themselves. They work with other HIV and AIDS organizations in their area to address the problem in their community, such as the Houston Area Ryan White Planning Council and the Houston HIV Prevention Planning Group.